Hello, hello. My name is Jess, and this is Patient POV. And today we're going to hear from Cheryl, and she is going to get into all things arthritis, rheumatoid arthritis, as well as the mental health side of having a chronic illness, which is quite applicable to anybody with a chronic illness, not just rheumatoid arthritis. And a few of her other conditions she speaks about. It's not just that specific. It's very applicable to anybody with honestly any mental health condition, but specifically um, rheumatoid or specifically chronic illnesses. Pardon me. And so, yeah, I'm so excited for you to hear from her. She's such a great speaker. She has a podcast of her own, so go check her out over there. I have linked her all in the description in terms of where you can find her on her Instagram, her podcast, and her website. So go give her a check out and give her some love over there. But yeah, just a few housekeeping things before jumping in. Don't forget to like, subscribe, and all that good stuff. And just a reminder that there'll be one more episode, and then I'll be off for a little break for the summer. I might do a few special episodes over the summertime, but it will mostly be a break for the summer, and then we'll launch back up in the fall, I assume is going to how it's going to work out. But I will keep you updated. How you can get updates is through my Instagram at Jess underscore and underscore Elda, which is ELDA, and that's my service dog in training. So yeah, that's that. You can also head over to patientpov.ca and I will have updates there. You can also find some freebies, some product recommendations, and more information about the podcast. Yeah, and also don't forget to use the discount code. It's Jess underscore and underscore Elda, ELDA, to get 15% off some days. Some days is a Canadian company, but you can get it, I think, internationally, completely internationally now. And it's a period relief company. And some of my favorite products from them is the cramp cream, which is absolutely a lifesaver from somebody who gets really bad period cramps. It has been great for reducing pain. It also can be used almost anywhere you get like muscular pain. And so I've used it on my legs. My mom has used it on her shoulder, and it helps reduce the pain, but it is completely plant-based, plant-made. And so you can use as much as you want without feeling like you are using medication that is not going to be super great for your body because it's all natural and plant-based. And so that's amazing. So head over there to somedays.com and you can use Jess underscore and underscore Elda, ELDA at checkout, just like my Instagram handle, or you can go to https colon slash somedays.com slash Jess underscore and underscore Elda. All of these links are in the description. So head over there if you're interested. Again, 15% off. But yeah, I appreciate you guys all and all your support, and I hope you have a great week ahead. Hello, hello. How are you today?
Good. Thanks for having me.
No worries. Thank you for joining us today. Do you want to just jump right in and give us an introduction on kind of who you are, your health journey background, what's going on with you?
Yes, yes. And I will say, preface this by saying I once did a 45-minute video just on how I got diagnosed with rheumatoid arthritis. So I will just give you the short story. So
Yeah.
my name is Cheryl Crow. I'm 42 years old, and exactly half my life ago, at age 21, I was diagnosed with rheumatoid arthritis. And I also got diagnosed a year before that with gastroparesis and generalized anxiety disorder, which at the time I didn't really identify with having anxiety because I thought my anxiety is just caused by my health issues. Like once I get my health sorted out, I won't have any anxiety. But in the years since, I've understood and accepted that my brain does tend to be on the anxious. Okay, see, I'm still working on accepting it. My brain, I do have anxiety.
Yeah.
Just put it that way. I
No.
accept it.
Yeah,
Yeah.
I love the I'm still working on it, and this is, like, the
Yes.
proof that you are still working on, like, the accepting part of it. Yeah.
I think that's a whole other fascinating thing of just the stigma against mental
Mm.
health and and recognizing that anxiety has brought some good things to my life. Like I just literally went to the dermatologist this week and they were like, "You're so good about sunscreen." I was like, "It's because I have anxiety about getting skin cancer." Like, you know
Yep.
what I mean?
Yep.
It's not all bad or good.
Yeah.
But yeah, so then I also 6 years after my diagnosis, I became an occupational therapist and I specialized in helping children with developmental and physical disabilities. And then during the pandemic, I started my own little project, quote unquote, a little talk show, which turned out to end up called Arthritis Life, all about how sharing life stories like you do on your podcast and also helping people figure out or share their stories about how they have crafted like a vibrant, meaningful life with chronic illness instead of making everything about like fighting it or trying to
Mm.
defeat it. So that's been a really, really interesting thing. So that's what I run now. I run support groups for people with inflammatory arthritis, which is the autoimmune types of arthritis, like rheumatoid.
Like rheumatoid. Oh, amazing. Yeah, that's really
Yeah.
awesome that it's been able to evolve and develop as time has gone on.
Yeah.
Can you just speak a little bit more in terms of you were mentioning like accepting the mental health side of things.
Yes.
I'm wondering if you can speak onto like the stigma that you were mentioning, but
Yeah.
specifically with the stigma of like people with chronic illnesses having mental health and how that affects things.
Yeah, I think specifically anxiety is the topic I can speak more to. And
Mhm.
so I don't think I've ever had depression other than maybe postpartum. I just had postpartum just who am I? Like what is happening? That's how I describe it. I didn't get so just really quick to put everything in context. So 10 or no, yeah, 10 years after my diagnosis, I had my son. I have one child.
Okay.
And so I didn't get any therapy or mental health support other than trying anxiety medicines under the care of a psychiatrist who I just like saw 2 times prior to this. So I didn't go get mental health support until I was postpartum. And the reason that answers relates to your question is because there's a lot of work people have done in the mental health community to make people who feel less ashamed of having postpartum depression or postpartum anxiety. So
Mm.
I feel like I was finally able to recognize that I had anxiety and really accept it then. But what was funny is I went to therapy to try to work on adjusting to being a mom and my anxieties around that. And of course, we ended up that was what we talked about initially. Then we ended up uncovering the layers of how chronic illness affects everything because I kept telling her initially, well, I'm having a postpartum flare up, which is really common for rheumatoid arthritis. So in my RA is kind of the shortening of for rheumatoid arthritis. So like POTS is for postural blah blah blah. So it's really common to have a good pregnancy, like an easy remission. Your disease goes into remission during pregnancy often, and then you have a postpartum flare up. So I kept telling her, okay, we're gonna figure it out because my disease had been well controlled before pregnancy. So I was like, I don't need to worry about my chronic illness right now because we're gonna figure it out. So I had this very like it's a solvable problem
Mm.
thing and mentality, which is I call like wayward optimism. Like, okay, we're gonna figure it out. At a certain point, like there's a thin line between optimism and denial. And then she was kind of able to be like, okay, well, what if we don't figure it out? Like, what if this chronic illness and like is a perpetual problem in your life? Like, can you make peace with uncertainty and anxieties around your health? Rather than like anxiety makes you want to seek certainty and seek solutions
Mm.
and which is helpful if there is a solution. And as those of us who have chronic conditions with no cure or no guaranteed treatments, like there's a lot of treatments for rheumatoid arthritis, but the problem is often your immune system adapts to them over time. So like I'm on my fifth different medication regimen in 20 years. So it's the target is always moving. It's a
Mm.
moving target. It's not like there's one medication you just take forever. So she helped me a lot with that. But the
Yeah.
initial stigma was just that I was told before my diagnosis, you're not sick, you're just anxious. So that really was a barrier for me because I was like, no, you're not. I am sick. Like I was basically medically gaslit because they kept saying you're not sick before I got my RA diagnosis. So
Gotcha. Yeah. And
yeah.
so I guess a two-parter here. You can either answer both of them or
Yeah.
just one of them is, the first part is, have you learned any and are using any techniques in terms of, like, accepting the unknown and, like, how do
Yes.
you cope with that side of it? We can start there,
Yes.
actually. Let's go there.
Okay, so I brought this out. It's a great book called the Happiness Trap. It looks just like a pop psychology book, but I highly recommend it. It's the subtitle of it is How to Stop Struggling and Start Living: A Guide to ACT, the mindfulness-based program for reducing stress and anxiety, blah, 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 blah. Okay, so it's by Dr. Russ Harris, who's a psychologist. Acceptance and commitment therapy is like the most helpful approach that I have found, and it has a lot of evidence for it, particularly for chronic pain and chronic illness. And the reason is I kind of think of it as if traditional mindfulness based practice and CBT, cognitive behavior therapy, had a baby.
Mm.
Because, but let's start by the word acceptance. Okay. So I did not, the word acceptance in the framework of ACT, acceptance and commitment therapy, I'll just call it ACT.
Mhm.
Acceptance does not mean giving up hope or thinking that things are always going to be a certain way. Acceptance, I love the definition Dr. Russ Harris gives. Acceptance means taking what's offered in the present moment,
Mm.
just in the present moment, just for that moment. So right now, life might be offering you pain, might be offering you uncertainty. And there is actually a difference between saying, no, I'm just going to do a coping tool or something to like to minimize my stress about that or minimize my anxiety versus saying I'm going to take this. I'm going to actively say this is allowed. I'm allowing this to be here right now, and it's like such a paradox because
Mm.
initially again my inclination was to be, oh, I just need to like take a deep breath and feel okay about it, but instead of trying to force yourself to feel okay, you say, wow, like I don't like this, but I'm going to allow it to be here. I'm going to sit with it. And then you actually feel better, but you can't make it your goal to feel better. So it's very, very, I find it very fascinating. It took me a long time to understand it. It was a combination of reading The Happiness Trap and going to individual therapy, but it's been so helpful for me. So it's that uncertainty. I don't have to like it, but it is part of life. Like, and the more I try to cling to, no, I just need to eliminate uncertainty and then I'll be happy, the unhappier I am.
Right, yeah, it's like the pressure you're putting on yourself to be happy. Yeah,
Exactly. And that is the happiness trap, is the more we seek happiness, the less likely we are to be happy.
really
Um,
interesting,
yeah.
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 I'll put the link to the book on the
Yeah.
description so that people can access it, and then it'll also be linked on my website as well. I'll do that because I absolutely love that. I'm always looking for recommendations. Um,
It's one. Oh,
pardon
can
me?
I say one more thing? Because I forget to say this sometimes.
Please.
So ACT is there's like a three-step process. The first is the mindfulness part where you say, but you actively accept it, you actually actively make space for and make room for the discomfort or whatever you're feeling. It could be happiness. It's whatever you're feeling, you just stop and say, what am I feeling in the present moment? This is allowed. And then the commitment therapy part is you say, what you commit to acting according to your values along with whatever crappy things are happening in your life. So you say, okay, well, with arthritis, with joint pain, with fatigue, with unresolved health issues, how can I still live like a vibrant, meaningful existence?
Mm,
Which he differentiates in the book. That's a lot different, right, than saying, how can I make my life, how can I make my life better? Like in terms of like my health better. Like, how do I solve my health issues? To say, okay, well, they use this analogy like passengers on the bus. Like, what if anxiety, joint pain, fatigue, what if I'm driving this bus and instead of saying, I have to eliminate these bad passengers on the bus before I can move on to driving towards like a meaningful, vibrant existence. You say, okay, well, some of that energy that I was using to try to solve a potentially unsolvable problem is wasted energy. And instead, I can say, well, what if my joint pain never goes away? Like I'm 41 years old. What if I have this the rest of my life? Well, I'm not in a coma. Like I still have choices, you know? And
mm,
it's like it's a little bit of like a blunt like reality check. And it's not to be like, it's not at all to be toxic positivity or to say like you shouldn't feel bad because you're not in a coma. Like it could be worse. No, but it's recognizing you do still have choices in your life. And be careful not to make your entire life about controlling your disease. Again, not in a way that says like, don't let your disease rule your life. You're in charge of blah, blah, blah. It's to say like that which you hold holds you. That's from Tom Robbins, and it's actually, he's a fiction author, but it's like the more people cling to this idea that they have to first eliminate all their health issues before leaving a good, meaningful, vibrant life, the more that cages you in,
Mm,
because you're blinding yourself to the possibilities of still living a good life with this. And this is all a lot more possible if you have mild to moderate disease activity than like severe.
right.
It's very, very, so I don't mean to say this is applicable to every single situation. Like
Yeah.
I'm in like mild to moderate disease activity. I don't know what it's like to live in like severe unrelenting pain, but according to this framework and according to some of the trainings I've taken on it, it's still evidence-based for helping people in really in severe pain. I just don't know how they do it because that sounds really hard.
Yeah, no, no, for sure. I think what I try to provide here as well is just like this may or may not work for you, but give
Yeah.
it a try. Do the research on it, and it's another thing that you can try to implement and see if it is helpful. And yeah, my second question was about you were mentioning the medical gaslighting, and so
Oh yeah.
I'm just wondering if there was anything that you have learned along your way that was helpful in overcoming that medical trauma of like how do you go into an appointment now and not be worried about being medically gaslit or like, do you know what I mean?
Yeah.
Yeah.
I can't eliminate that worry because that worry is rational. It's
Mm,
a rational fear because it happens, right? So again, there's that mindset of saying like this is a phenomenon in life that I'm going to encounter,
mm,
and allowing me myself to have that fear makes it less scary. And I think also, I mean, there's nothing that has ever been as difficult for me as that feeling of helplessness before I got the validity of my diagnosis. Because
mm.
once you have a diagnosis,
Yeah.
even though you're going to be medically gaslit at times, it's like you at least know there's something legitimately quote unquote wrong or empirically wrong. Whereas like that was so difficult. I'll never be over that. Like, at least that's how I proceed through my life thinking that I'm never going to be over that. Like every time I literally get like teary every time I talk about it. So I'm like, this is okay. If this acceptance thing doesn't sound good to you, like totally understand. But I'm like, this is okay. Like I'm a human being having human emotions. It's kind of like that Inside Out movie, where it's
Yeah,
about like,
yeah.
don't just say, I just need to feel joy all the time. You say, we need sadness. We need anger. Like, of course I'm upset about this happening to me. Like it was horrible.
Yeah.
And like, I do say, I carry forward maybe when I have medical encounters now, it is kind of a know better, do better thing where I say, I know a little bit more social scripts to say, like, okay, I understand. Let's say that they're saying, oh, we don't really think this is a big deal or whatever. Like, I understand that the most likely, according to you, the most likely, or according to all of your expertise, like, I respect doctors, right? Unless they're being outright, if they're being outright horrible, then there's no point. Find another second opinion. But
Right.
if they're like, look, I'm listening to you, but like, I really don't think this is like a big deal, whatever it is you're experiencing. You can say, like, I understand that you're saying, like, most likely, maybe 95% likelihood, it's not a big deal, or it's not, I don't know. Like, I started having neurological issues. And so I got evaluated for multiple sclerosis. And my rheumatologist was very supportive of that. But let's say theoretically she wasn't. And she's like, it's not MS. It's not MS. Very unlikely it's MS.
Mm,
You can say, okay, well, understanding, like, in my head, like, help me think through this reasoning. Like, it's unlikely, but it's possible, right? So what would you tell me? Like, how would I find out if I was in that only 5% likelihood? Like, what can I do to find that out?
right.
Because that's for you. That at the end of the day, like I've talked to doctors about this before, like in the context of going to like medical conferences and stuff. Like if you have 100% of your patients let's say 100 patients come in a day and they're all concerned with the same thing, that is a very rare thing that only happens to like 2 or 3% of people. But 100% of the time, you're telling everyone that that's not going to happen to them because it's so rare. You are missing 100% of the people. I know I'm preaching to the choir, but
No, yeah.
their job is to work on the population level and make decisions based on what's most likely to occur. But
Right.
that doesn't help rare disease patients because so it doesn't mean they're being mean. It's like they're up. Sometimes people are actually actively gaslighting and they just are horrible. But do you know what I'm saying? Like there's this big gray area. So part of I think I was very naive to the medical system back then, and I didn't understand that gray area that they were looking at me saying, look, you're kind of like a type A 20-year-old, like you're just anxious. you
Right.
know, as opposed to recognizing, yes, it was unlikely that I was having rheumatoid arthritis, but I did, you know?
Right.
So,
Yeah.
you know, anyway.
No,
Yeah.
yeah, yeah, yeah. No, thank you for that. And so speaking on your rheumatoid arthritis,
Yeah.
what would some of the like challenges that you face in a day to day? It could be about rheumatoid
I
arthritis.
know it's hard to
You,
say.
we'll go RA.
All right.
um,
Yeah.
yeah. And but you also mentioned like gastroparesis, like any of your health conditions. Like, what are some of the challenges you face on like a day to day or week to week basis?
I think honestly, the hardest part for me is the uncertainty.
Mm,
Is like I've over and I it's such a like rude awakening. And I'm like, I run support groups with people, and it's like I don't like I want to tell you that if you just symptom track, you're gonna figure it out. But it's like, yes, you will figure out some patterns, right? I have some so identifying my I think that the hard thing is identifying my reliable triggers from the randomness of life. So saying like for fatigue, for example, I know for sure if I go out in the heat and or sunlight for a long period of time, or even heat for like 30 minutes, depending on how hot it is, those are huge fatigue triggers for me. So I'm pretty certain, right? There's a bucket of things that I'm certain that I'm going to feel bad if I do them. So
mm,
I won't be surprised if I feel bad when I do them. And then there's on the other side of the spectrum, randomness of life, right? You can say, okay, did everything I know how to do. Like I took my meds, I did my strategies, I managed my stress, and then you wake up and you feel really crappy. And that's I think the hardest part is no, and that's why for me, so yeah, I could tell you like, yeah, joint pain feels like this, fatigue feels like that, but it's like it's the not knowing, it's the
mm,
uncertainty that I still struggle with. And part of the reason that the acceptance-based therapy has helped me is because there's a difference in ACT. They call it clean suffering versus dirty suffering. So let's say I wake up and I feel fatigued. The clean suffering is like the immediate reaction to that. Like I it doesn't feel good to feel fatigued, right? It doesn't feel good to wake up and feel like you have like creaky joints. Um, as well. So but the dirty suffering is where relates to how you responded to that and created more suffering because of your thoughts around that.
mm,
Which I know sounds a little judgmental, but it's a helpful, that's kind of more the classic cognitive behavior therapy to say like, okay, let me look at these thoughts I'm having around it. Like the dirty suffering would be like, oh my gosh, like I must have done something wrong. What's wrong with me? Like I didn't manage my energy well enough yesterday. That must be why I'm having a fatigue flare up, or it's never going to get better. It's, you know, and having all these additions, you know what I'm saying?
yeah.
So learning the coping tool is like learning to say like, okay, like accepting the randomness of it is actually helps me not spiral, because it
Mhm.
helps me say like maybe like a butterfly flapped its wings in Asia and like I feel like crap today, and like that's just how life is sometimes, you know?
Yeah, no,
Um
for sure. Yeah. And so, thank you for that. That is all amazing. I'm wondering if you said that you got diagnosed at 21, then you became
yes,
an OT at 27-ish, give or
I
take?
guess.
6
Yeah, it
years later,
was
you
oh, so
mentioned?
I started OT school 6 years after my diagnosis, and I finished at 8 years. So
Okay.
I guess
Okay,
29.
wonderful.
Yeah.
Yeah, yeah,
About,
yeah.
yeah.
And then but now you're doing something different. Can you tell us about
Yeah.
what your platform is, how you got into it, and what you're trying to
Yeah.
work on now?
Yeah, yeah, and so I am using my skills, like, in my degree in occupational therapy, in the sense that I'm using it, I used it to create a self-management program called Room to Thrive. And self-management in the chronic illness world, it just means teaching patients the tools to manage their condition on a 24/7 basis, given that, you know, the traditional model of therapies for physical therapy, occupational therapy, speech, they're really based on an acute injury, and you go to therapy for 6 weeks, 8 weeks, 3 months, and you work on something. It's like you break your shoulder, you rehab your shoulder, and then it's better.
Yeah.
Whereas for chronic conditions, like I do think chronic illness patients should have access to more occupational therapy and physical therapy. We also recognize though that at the end, like 1 hour long sessions where people are helping you, walking you through things, you know, exercises, coping tools, everything like that. But at the end of the day, you as a patient are going to be living with it 24/7. So it is beneficial for you to learn, like, you know, teach a man to fish essentially.
Yeah,
So
yeah.
I was aware of this. concept of self-management. But I initially consciously didn't specialize in arthritis as an occupational therapist because I didn't want my whole life to be about arthritis, which is
Right.
hilarious because then flash forward 5 years and I like started a company called Arthritis Life. Like arthritis is my life now. But I've evolved. I've learned how to, have boundaries around things. I'm still learning. But point being, it honestly, I'm trying to think of how to say this succinctly. I was working in pediatrics with kids with developmental disabilities, which is an area that for wonderful reasons, a lot of occupational therapists like to work in. And so I was like, but I was getting annoyed because I would volunteer at the Arthritis Foundation events and I was annoyed at, not the Arthritis Foundation, at the fact that all these patients I was meeting with arthritis, I was like, I'm going to work with kids with disabilities in the school system. And then in my volunteer time, I'm going to volunteer with arthritis. And that was the boundary I was going to have.
Right.
But then I was like, why is no one educating these patients? Like, it's driving me nuts. Like, why are we giving these kids with, I don't want to name disabilities, but disabilities that are valid, that they get occupational therapy, they get
Right.
therapy, they get all these services and supports. And the kids with juvenile idiopathic arthritis get nothing. And the
Mm.
adults with rheumatoid arthritis get nothing. You get a 20-minute appointment every 3 months.
Oh, goodness.
What? And then the rheumatologists are like, why are these patients going on the internet and getting misinformation? You're like, you are giving them nothing. Like, so I was like, okay, I'm complaining about this. I'm obviously passionate about this, but I'm like, someone needs to do this. This is not rocket. What's shocks me is it's not rocket science. Like, it's just that no one, but it takes time. It does take time. And so why is no one doing this? Why is no one doing this? And then finally I was like, I could do this.
Yeah.
Like,
No, I love that.
someone should do this. So I've developed a kind of a step-by-step program to teach people the
Mhm.
skills to manage not just pain and fatigue, but the other ways it affects your life, like mental health, social skills, and executive functioning skills like symptom tracking, stuff like that.
Amazing, yeah. And so do you work, like I know you said you have, like,
Oh yeah.
groups, but then do you work one-on-one with people? How does that what's that setup like?
Yeah. So initially I structured it as I have a self-paced course and then I have a support group. Everything's online. So the self-paced course is online. It's like I like to say it's like your orientation manual for living with rheumatoid arthritis or other inflammatory forms of arthritis.
Mhm.
Then I have an optional like support group you can do along with that, where we have time for people to ask questions about the stuff that I cover in the course, and then they also connect and like facilitate. I facilitate like a peer support group. And then I just this year, 2023, 2024, started doing like one-on-one, quote unquote, like wellness sessions where it's just basically like hey, like if you're struggling with XYZ and you just want to like pick my brain about it. I mean, I have to be a little bit careful because, I am a licensed occupational therapist, but I can't provide occupational therapy across like state lines. So I can only, the way that the laws work, I'm only able to offer. And when I'm doing a consulting or a wellness consult, it's not full occupational therapy. If I was doing occupational therapy, it'd be like a whole process of an evaluation and a treatment plan, and we make goals and it's more rigorous. But again, there's this giant gap, right? There's a gap between like the patients who need that amount of rigor and patients who are just the patients need more. There's some patients who 20 minutes a month, 20 minutes once every 3 months is enough because they're in medicated remission and all they need to do is just do a check-in on their meds and their blood work.
Right.
It's not that everyone needs more, but there's this giant, like, it's like they call it the donut hole model. Like the people who are
Mm.
doing really poorly are getting services. The people who are doing really well, like, are getting adequate services, like, because 20 minutes every 3 months is adequate for them. And then there's this giant hole in the middle. People
Mm.
who are like, they're not doing great, but they're not so horrible that they like need to have a joint replacement surgery, but they're still struggling to function. So that's kind of the hole I wanted to fill. And I have a podcast too, which kind of
Yeah.
touches on the same topics. Yeah.
Amazing, yeah. I've never heard of the the donut model of
Oh,
thinking, and so that's really interesting, and I'm so happy to hear that you're filling a gap for so many people. And, what kind of things do you chat about on your podcast as well, or what is the name of the
yeah.
podcast as well? Yeah.
Well, what's funny is when okay, so I'm really obsessed with acronyms. So,
No, I love
so
that.
when I started Arthritis Life, life stands for life hacks, interviews, fun, and education.
I
And
love
then,
that.
so yeah, the podcast is basically about 70-30. It's like in terms of 70% of the time, it's patient stories,
Mm.
but throughout the patient stories, I kind of sprinkle in like evidence-based, facts or things. Cause I think one of the things I get concerned with, which with sharing anecdotes, is that anecdotal evidence is our brains are so primed to want to make large conclusions from that, but we have to be careful, right? Because if you go on social media, it sounds like everyone is curing their condition through diet, and that is not the case
Yeah.
statistically.
Yeah.
So we do that, and then I also have like other like there's actually quite a few people who are both a patient and a healthcare expert, so rheumatologist that also has a inflammatory arthritis condition, and they come on and share, like, maybe there's one about a physical therapist who has rheumatoid arthritis who shared her best tips for exercise, or tips on specific conditions like if you have Sjogren's disease and rheumatoid arthritis, what are some things to think about. And then I also have solo episodes just talking about like just best advice for newly diagnosed people, or tools for your flare up toolkit. So that's really the education and the sharing of life stories that's been it's been really great. It's been really fantastic to see that people just want to feel seen,
Yeah.
so it's a way to share their stories and give them a platform.
Amazing. Yeah. And can you just remind me one more time, what's the name of the
Oh
podcast?
yeah. It's called just the Arthritis Life podcast. So, and
Amazing.
yeah,
And that's where
yeah.
the life comes from. Wonderful.
Yeah, yeah.
And my last question here for us today is if somebody was either like starting the diagnosis journey or they are in like the thick of a flare, do you have any advice or words of encouragement for them?
Yeah. So just started getting diagnosed versus in a flare. Yeah. I think that when you're in a flare up, it's a survival mode. So I think I have a little series of mantras that I try to remind myself in those moments. Like my now is not my forever. I can do hard things. And like measuring your life in increments, small increments, like just get through the next 5 minutes, get through the next 5 breaths. I think when my anxiety tends to be triggered when I think too many steps ahead. How am
Mm,
I going to get through this tomorrow? How am I going to get through this the next day? What's going to happen in 5 years? Oh my gosh, am I, there's anxiety. My therapist kind of explained to me the difference between fear and anxiety. Is fear is about something really specific, like I'm afraid that this plane's going to crash and I'm going to die,
mm,
versus anxiety is very non-specific. It's like something I'm afraid, I'm worried something's going to happen, like
mm,
something as bad is going to happen on this flight. Like, what is it? Because I happen to have claustrophobia, so I actually think and claustrophobia, which is fear of being trapped. So, like, for example, I don't mind being in a crowded space as if I can get out. So, like on an airplane, when the doors open, I'm okay. But the minute the door closes, even if it doesn't matter if we're in the air or not, I really don't like the feeling that I can't get out if I need to.
mm.
So it's and those kind of, and I've worked a lot on exposure therapy for that and stuff. So I'm doing a lot better than I used to, but it's still hard. It's still difficult. My brain, it's like caveman part of my brain. It's like, don't get stuck here.
Yeah, yeah.
Yeah. So some evolutionary remnant. But then, and then if you're in a flare up, when you're in kind of when you're in the newly diagnosed stage, I
Mhm,
think one of the most important things is to understand that um that you, you're going to end up needing to balance a fixing mindset with an accepting mindset, and doing that as early as possible I think is really helpful. Most people initially they have that kind of optimism that states, I'm just going to figure this out. I'm going to conquer it. I'm going to fight it. You know what I'm saying? And I understand that impulse because I'm a fighter, quote unquote. I'm a former college athlete. Like, I understand that, like, I'm going to rally. But if you proceed with the expectation that you're going to find like the solution, you're most likely going to be disappointed at some point. So the earlier on in your journey, you say, like, I'm going to fix what I can about this, and I'm going to learn how to live with it.
mhm,
Like, I talk all about living with arthritis, not fighting it, right? This is part of your life. Like, this is whatever it is that's causing your suffering, whether it's POTS or EDS or, whatever acronym sandwich, RA, AS, PsA, psoriatic arthritis. Um, Learning to like have a state of harmony with it. And again, I like feeling like I'm not any sort of like mindfulness guru. Like, I feel like I have very chaotic energy, but part of mindfulness, it's not about being peaceful. It's about connecting to whatever it is you're feeling in the moment. So knowing, like, I think of arthritis as just part of me. It's not like I'm not trying to fight it constantly. I'm trying to manage it, but that helps me a lot, and I hope it helps others too.
Amazing. Yeah. And where can people find you on social media?
Oh, well, little business advice. Don't make different names for everything because so my website is arthritis.theenthusiasticlife.com.
Okay.
And then my social media, my most active ones are TikTok and Instagram. On Instagram, it's arthritis_life_Cheryl. And on TikTok, it's at Arthritis Life. So I have literally different names on everything because I just wasn't able to get the same name. Anyway, it's okay.
It's all good. Yeah.
But my
Yeah.
name, my full name is Cheryl Crow, like the singer. So it's spelled with CH. So one thing is to be careful when you're Googling, like just say like Cheryl Crow and then like arthritis or something, because otherwise you get all like the famous singer stuff from Cheryl Crow the singer. Yeah.
That's so funny. I love
Yeah.
that. No, but I will also link all the like I'll have all those links in my bio so people can refer to that, but just in case they're
Good.
listening, they know where to go. But
Exactly.
I do thank you for coming on the podcast and sharing your knowledge. I really do appreciate you taking the time.
Oh my gosh. Thank you so much for having me. And thanks for having such good questions, and you kind of found a way to like make sense of what I was saying, which is helpful for me.
Of
But I tend to
course.
ramble when I get excited. So thank you so
Yeah.
much. And
No,
keep up your good work. I think the more patient stories we share, the better.